We're going to record this. First, I want to take the, I'd like to begin by acknowledging that I am joining from Treaty 6 territory, the traditional lands of First Nations and Métis people. It is with great humility and responsibility that we pay respect to the Indigenous people of all the lands and territories from which we are joining in from. Team CarePal is a champion of caregiver-centered care. Caregiver-centered care is an education program tailored for health and social care professionals interacting with family caregivers. It is co-designed by caregivers and developed under the guidance of University of Alberta. So we promote their education in our products. Sorry, and we will be showing a couple videos today taken from their courses. So family caregivers are the largest group of healthcare providers in Canada. There's over 8 million of them. In fact, 1 in 4 Canadians currently look after a family member or friend with an illness, disability, or aging needs. And this number is going to be going up in the next 10, 20 years as our aging population continues to age. This group provides 90% of total care in our communities, which is valued at over $97 billion in unpaid labor per year in Canada. And in fact, there's over 1 million caregivers right here in Alberta. And so I just wanted to share my screen really quickly. And I'm going to show you guys a little video. Oh, can you guys see it, or am I on the wrong screen here?
It was there a second ago, but then kind of went off.
Are you seeing my desktop now?
No, black screen.
My apologies. There?
You know, it's not playing. It shows your desktop, but it's got kind of it just shows your folder, but I can hear it. It's having some kind of an issue for sure.
That one real quick. Oh yeah, we got the shares done. How about here?
Perfect.
I'll see you on Wednesday, Mrs. Fawcett. Oh, hi, Chad.
Hey, how did Mom do today?
She's getting stronger. We had a good session. We'll have another on Wednesday.
Cool.
Looks like your family's home.
It happened. She lifted her stick and I got it in. Chad, I scored a goal.
Good for you, Carly.
Well, run up and tell your mom. I'm sure she'll want to hear all about it. Hi. Are you one of Leanne's nurses?
Good PT, physical therapist. My name's Natalie.
Hi, I'm John Fawcett. And you've met Chad over here. And that whirlwind that went rushing past you upstairs is Carly. How's Leanne doing?
Good. Tired, though. She's frustrated that stroke recovery can be so slow.
We're all frustrated with that.
Chad, adjust. We all depended on Leanne. She was always so healthy. The stroke has been like a thunderbolt for our family. It's still pretty new for all of us.
Of course. Recovery isn't just hers, is it? I should get out of your way now. You have your hands full.
Oh, you have no idea. Carly has hockey 3 times a week, and she has skiing lessons on the weekend. Chad's on the swim team, which means early mornings. We're all on different sleep schedules. Leanne needs help eating. She needs help getting from room to room. Mostly, I carry her. I sort through her pills, and I pick up the new one at the pharmacy. Chad's given up his bedroom for the rehab equipment. He's sleeping on a couch in the basement now. Carly needs new glasses. The roof is leaking. Car needs repairs. We've lost Leanne's income, and I'm not always able to work from home. We've been to the clinic and the hospital twice each this month. And when Leanne's asleep, I worry that she's having another stroke. She gets frustrated with me when I can't understand what she wants. Well, I get upset too. Yesterday I found her in the kitchen crying because she'd forgotten how to make a sandwich. So, can you help with any of that? Well, thanks for all that you can do.
So that was part of the Caregiver Centered Care Co-Design team. And, we, Team CarePal, surveyed many caregivers like John in 2021. And we learned that on average, they use 7 different tools to manage their caregiving role, as many as 14. These were pieces of paper, notes here and there, text messages. They were all very segmented and things were being missed, appointments were being forgotten about, and it didn't allow for any kind of collaboration. So what we did is we put all of the tools that caregivers were using and we put it into one mobile application. Caregivers typically don't plan on being a caregiver. It's not something they grow up wanting to do. It happens overnight, an accident, a diagnosis, and their worlds are forever changed in an instant. Not only are they usually trying to process what just happened to their loved one, but now they get thrown information from many different areas and all different angles. So Team CarePal really is an all-in-one management tool that will allow caregivers like John to keep it all into one place and get the support from their family and friends. We know that getting respite from family and friends is one of the best ways to reduce caregiver burnout. And so I'm just going to take a quick second and show you guys our mobile application. There we go. You guys can see it. So upon entering the app and their homepage, you're going to see an area there where John can make announcements to his community. If you go down into settings real quick, this is John Fawcett. He was the caregiver from the video. And what he did was he started a Team CarePal application community, and he invited all his friends and family. So he's got his son in here, sister, the coach who's a volunteer, and other friends and family members. And so they're all a part of this app. And so he can keep them updated by posting announcements, which is really a difficult thing for caregivers to stay on top of. When you're dealing with a loved one, it's hard to make sure that everybody knows what's going on, and information can get lost very easily, being spread from family member to family member, and people can get really frustrated. So this is a great place to, once John posts an announcement like Leanne is home, everybody gets an email notification, and you're going to see some cute little pictures of my chief product officer's dog. But typically, this is a great social feed for family and friends to post and update each other and how things are going, and just stay connected. We found that being connected throughout caregiving is a really important factor in reducing caregiver burnout. You're going to see some great little events being posted on here that are shared with this family as well. So we have a calendar that does exactly that. So John can actually create events for, appointments, or maybe it's visiting hours for Leanne, or, maybe it's work fees or those types of things, just to keep everybody all organized. He can track the RSVPs. He can actually, invite specific people or the whole community. So it's very, very flexible. And when John makes an appointment, it's actually, he can do it strictly just as an appointment, and then only caregivers can see it. If you notice, when he set up his community, there's 2 users. There's caregiver users, and then there's community users. When we talk to caregivers, we realize that while there is, the caregivers at the front lines, like maybe me and my brother would be looking after my parents, and managing, medication and mobility and stuff, that maybe the neighbors and our long distance cousins don't necessarily need to know that information. And so community users actually don't get to see all the features in the app, including appointments. Task lists are an incredible feature that we added. We collaborated with a Family Caregivers of BC on this one. They have this beautiful program where they work with family caregivers to try to write a list out to get help from family and friends, but caregivers typically have a hard time of picking up the phone and actually calling and asking. So this way, family caregivers can write lists of things that they need help with, and everyone in this community can go in and take ownership of those tasks. And when they do, it actually gets put over into my tasks. So these are all the ones that I have offered to help with. And John still has some other things like take Carly shopping and those types of things. So it's a really great tool to help keep everybody organized. The other area in here is a caregiver journal. So we learned that caregivers have these pieces of paper all over the place, and trying to keep everything in one area was a really hardship for them. Community users do not have access to this. They won't even see it. But one way that caregivers can stay organized is that they can actually build this out almost like a binder. So maybe they have doctor question and answers. Maybe they're, going through medication to see if there's any side effects that their loved one is going through after starting one. So this is a great way for them to build out their little caregiver journal based on what their care recipients' needs are. And we've been add the ability to actually record clinic visits right into the journal. A pain point for family caregivers was when they go to a clinic visit, whether it's, doctor's office or PT or something, only one family member gets to go. And, a lot is missed in that appointment, maybe follow-ups or instructions on what they need to do, because it can be quite overwhelming. There's medical terminology, then you add, beautiful accents from all different cultures and languages. So things get missed, and that really impacts health outcomes. And so this way, family caregivers can record it right into the journal and actually revisit it later with other family members. Once we realized and dove into assessing family caregivers, we very quickly realized that they're burning out quite drastically. And when a family caregiver burns out, their loved one risks being institutionalized a little earlier than maybe what they would have liked. And so we decided to really tackle that problem head on. And so we encourage family caregivers to take our caregiver burden inventory assessment once a week. And we actually track the results on a graph for them, correlating it to the hours of care that they're providing. We know at 20 hours of care per week is a really pivotal moment when a caregiver's mental health starts to suffer. That's a lot to take on while they're, working full-time jobs and possibly managing kids and other things. And so we get them to take the assessment, and then we prompt it, we actually record it, and they can go through it on their own and review it with a specialist, like a coach. If they're working with a coach, it goes through their time dependencies, like how often are they having to, be one-on-one with their caree, physical health, social relationships. Is a caregiver now starting to isolate? And is it impacting their own health and well-being? Once they complete this assessment, they actually get notified to go into check in with Zolo. And Zolo is our brand newly launched AI digital navigator bot. Caregivers have a really hard time trying to find resources. They don't know where to go for help. They don't know what's available. A lot of times they don't even know how to ask the right questions. And so they can actually come into Zolo. Zolo is trained on the caregiver burden inventory assessment. Zolo has a Canada-wide database that is being built every day, more so in Alberta and Ontario currently, but we're working on the other provinces. But Zolo will be able to take the demographic of the caregiver, knowing that, say John, he lives in Rocky Mountain House. He is married to his wife who had a stroke. She knows about John's caregiver burden levels because of the assessment, and she knows, all the big important things about John. So, John can come in here and sees what exactly Zolo says. Hey, John, I see you're, having a hard time. Here's an immediate tip. Stroke care involves monitoring potential complications. So she's very encouraging. And then she'll provide 3 relevant resources based on all all that information. So right now she's suggesting the Rocky Mountain Health Center, the Heart and Stroke Foundation, and then of course Caregivers Alberta for that caregiver support. And then John can continue having a conversation with Solo, even just saying like, I am stressed and need sleep. And then, so once I send this, then Zolo goes through her database and she relearns everything about John, and then she'll respond, you know, in a very empathetic way. It is a closed database, which was really important to us, that Zolo isn't going to be pulling from just random resources or unvetted resources. So you guys can add your resources on our website. I can share that link with you guys afterwards. Solo seems to be taking some time. My apologies. I am joining, oh, there she is, from my RV, and I'm hoping that's not the reason why. I've connected to Starlink. So anyways, oh, I am stressed and need sleep. So yeah, it sounds like you're experiencing quite a bit of stress, and getting enough rest is crucial for your well-being, especially as a caregiver. Here are a few suggestions that may help you increase your sleep and reduce stress. So, you know, creating a calming bedtime routine, which is so important. And then the support information on how it can impact your effectiveness as a caregiver, manage tasks whenever possible. And then again, suggesting Caregivers Alberta, Primary Care Network, and then the Alberta Health Services. There's a healthy living program, the 811. So again, Zolo is just this great resource that can connect caregivers to all the resources that they need. Another really great thing about our application is that you can actually come into the resources area, and Team CarePal has navigators all over Canada that are willing to meet with family caregivers for free, and this list is growing. So if caregivers really wanted that more one-on-one support, they can get that through the navigations. And so, yeah, that's that piece of it right now. I'm going to continue on. So yeah, Team CarePal is available on the app stores right now as a pay what you can model. Only one person has to pay to set it up, and everyone they invite to is free. But I also wanted to talk to you guys a little bit more about our CRM. So when caregivers make the choice of putting their loved one into long-term care, this transition does not come easy, and is one often filled with guilt, second guessing, and sadness on the caregiver and their care recipient. A caregiver's role does not end when they put their loved one into continuing care. They continue to provide 15 to 30% of care in these congregate settings. They look after tasks like personal care, shopping, decisions about services. You know, they're the advocacy, they offer that companionship. So their role directly affects the quality of life for their loved one. Team CarePal launched a beta 1.5 years ago and put our app into the hands of a very diverse group of stakeholders. And we asked them if we could build them a dashboard, what would that look like? You know, how would they connect their organization to our family caregivers app, and what features would they want? So after receiving an incredible amount of feedback from the continuing care sector specifically, we actually created a caregiver relationship management software. So it's a dashboard that connects to the caregiver app. The feedback we got from continuing care executives is they wanted the ability to send out surveys to measure family satisfaction. They wanted to share policies and procedures so that all family members can access them, and not just the one who came to moving day. They wanted to provide contact lists to families, so families knew who to contact when they had questions, which saves staff time answering the phones. They wanted to onboard families in a more meaningful and compassionate way by scheduling tours and info sessions ahead of time, so it wasn't adding to the stress of an already heavy day. They wanted to support their family caregivers that had loved ones participating in their adult day programs and memory cafes, because the wait lists are getting longer and longer. They wanted to connect volunteers with families so volunteers can enter the application as well. They really just wanted to integrate families into the care centers more by engaging with them through events, communication, and activities. So, you know, we created our CRM from all of that amazing, amazing feedback. So I'll give you a sneak peek on what that looks like. So this CRM has the ability to provide organizations a lot of great metrics on their families. You will get an instant link. You can share this link with all of your families. And when they set up a family caregiver app, they actually get joined underneath your umbrella. And in this dashboard, you will be able to do all those great, meaningful things that I suggested. Like you can build out customized surveys that actually get sent right into the application for the caregivers to take. You can build out incredible resources for them, moving in documents, family first forms, and you can actually build out courses in here and layer them. It is such a beautiful way to connect to caregivers. So if you were to come in here, the moment a caregiver connects with you guys, it shows up in their resources exactly like this. And so it's just such a really great way to spread information. You could be able to chat one-on-one with your family caregivers in your organizations. You can also, build out an area in their journal so only caregivers see. So if you're wanting to share those contact lists for family caregivers, you can absolutely do that in the journal. There's a great area here where you can set up task lists. If this is something you wanted to do with social prescribing or maybe just doing onboarding checklists for them to come into the home. This is a great way to do that as well. You can create events, tours and stuff like that that will automatically go right into the caregivers app. And so this is just a wonderful tool. You can make announcements and stuff like that. So this is just a great way to connect to your family caregivers. You'll be able to monitor the average burnout as well. So you'll be able to understand if you wanted to connect with them, one-on-one and kind of learn a little bit more about them, you can come into here, you can post directly into their specific community. Whereas over here, these ones will post to all of your communities. And so you can do it, you can just streamline things so much easier. In here, you can also take notes on your family. So if you have lots of administrators in here helping out a family with something, you can absolutely, stay in contact and keep all the notes and stuff like that in here. So I just wanted to kind of share that with you guys on what that looks like. It's such an incredible dashboard created by so many stakeholders that we just launched it a couple months ago, and we've been onboarding our new clients. But I also wanted to really point out with you guys that the caregiving crisis goes far beyond just your clients. Continuing care deals with caregivers at two levels: the family caregivers of your clients and your employees, who also may be family caregivers. So many of your employees are going to be balancing caregiving responsibilities with work, potentially negatively impacting their work-life balance, work productivity, and their personal time. So, women on average are more likely to leave the workforce, miss hours, reduce hours, or take leave of absence than their male counterparts. And the majority of healthcare employees are women. So Team CarePal will also look after your employees and provide them with the resources and tools they need to look after their loved one. We know that a lot of Canadians are going to be in this role if they aren't already. And so we want to be able to support not only your clients, but your employees as well. So I just wanted to share one more quick video with you guys, and then we will move on to Kyle. And he's going to share this incredible health economic model.
And so that partnership, if you've established it early on with a family.
Can you guys see the video?
It's the same as last time.
Oh my goodness. Okay. It's Elizabeth Drance, and she is incredible. There.
Family member from the very early assessment. Now, as things move along and we are at a new phase of this person's illness, we need to make sure we engage all the information, the knowledge, and the knowledge of the person, and knowledge of the things that work well for them or the things that don't work well for them in the new assessment. So so for instance, when I'm caring for someone who's become much more fearful and reactive around their care needs, for instance, and often this might happen, for instance, in a nursing home, when we go to do a very detailed assessment to make sure we understand what's happening for that person or what things might be contributing, engaging their family member who sees them every day, who knows their style and their needs, and we may have forgotten what it was that was very important to this person, and we need to be reminded. So if we can engage family members in these discussions around with, you know, with the whole team, to sort of say like, okay, so what's going on here, they will then feel more trusting of the interventions that we decide to try, and also the interventions that are developed will be so much more robust. It's hard to do that if you don't have a good working relationship with that family member, and that goes back to why you need to develop a trusting relationship upstream for when things do get difficult. If they, you know, when they get difficult and you have that, it's gold.
And she's incredibly right with it. There is a massive gap between what family caregivers need and what they receive from the healthcare system. And so Team CarePal is an option to help deliver that caregiver-centered care. Based on our health economic model, by supporting caregivers with Team CarePal in Alberta alone, we will save more than $3.5 billion in total economic value. That is including savings to our healthcare system, increased health for caregivers, and additional wages back into the pockets of caregivers. So, I would like to turn this meeting over to Kyle Riley, who is going to walk us through his recent health economic modeling and how it considers Team CarePal's intervention potential to lead to better care for the caree and lower costs, as well as greater resilience and well-being for the caregiver. And then we can follow up with some Q&A. Go ahead, Kyle.
Great, thank you, Cindy. Yeah, just to speak a little to what the overall idea of the essentially, Cindy's delivered all these great arguments for why people should use Team CarePal, how it helps caregivers, how it helps carees. And the idea is to kind of quantify this and show both as a monetary value and as kind of a list of health outcomes, what are we really talking about here? Like if we were to use this, as she says, in the context of for every caregiver in Alberta, or if we were to use it for a caregiving organization, what should we look for to see the outcome of this, to know that it's working? And then more importantly, how can we quantify that value to say, bring it to the Alberta government and say, you should fund this, you should do this, this is what the outcomes are going to look like, and this is what you should look for. And the idea is that there's costs on the one hand, which are considered in dollars, in this case, Canadian dollars. But on the other hand, it's a bit more saprous. We're talking about patient health. And so there is a dollar value that's ascribed to patient health. We take it, it's $50,000 per year from CADITH. But more generally than that, what are we really talking about? And it's things like outcomes of, are we avoiding patient hospitalizations? Are we avoiding admissions to long-term care? Are they actually feeling better? Are they experiencing fewer falls? All of this kind of stuff are outcomes that we want to record, so that the idea is that we can really show value. We can stop thinking of, hey, this is all the ways that Team CarePal can help or could help, and say, these are the ways that Team CarePal is helping. We have strong evidence, and in fact, you should be using it more. And so that's kind of the background behind the model that I'm going to be sharing with you here. All right, and so as I say, we considered an early economic evaluation of Team CarePal. The technical term that I would use if you were describing this to somebody in the know would be it's a cost effectiveness model. But importantly, it's a cost effectiveness model that I've built without data from Team CarePal yet, because this is early stage and we're trying to show its potential and what it can do. And the idea is very much that once we do have data, we fill this model in and show evidence of what it has done. And so the idea behind this is, firstly, to drive the prospects of Team CarePal, which is to say this is a good argument for why you should adopt this project. And the second part of it is evidence of Team CarePal's effectiveness. You'd hope in 5 or 10 years that other countries are going to be looking at this and saying, we should do that too, and specifically we should buy that product. And so that's the long-term goal of this, is to start off by showing potential, to move towards showing evidence, and then to move towards showing efficacy. And so just some quick stuff about how this model works and what it is. It seeks to quantify the potential health benefits and cost savings. And importantly, it's to various stakeholders and payers. So these health economic cost effectiveness models in their original interpretation, they're meant for the healthcare payer on a social level. So in this case, it would be for Alberta Health and Alberta Health Services or whatever the government buyer is. I kind of extend the idea of these models to be able to show it to different stakeholders. You know, it's not always a government health authority that is going to be the first buyer of your health technology. And in fact, it almost never is. And so we seek to kind of differentiate who we can talk to and who we can show value to. You know, it can be a company looking to get benefits for their workers. It can be individuals looking to get benefits for themselves as caregivers or carees or their loved ones as carees. And it can be sort of patient health advocacy groups to show them the outcomes that are important to them. And so the idea is that the different outcomes of the model can be kind of structured and personalized to whoever Team CarePal is talking to, because we have to be able to speak the language of whoever we're trying to sell to, whoever we're trying to get to adopt this. As I said, this is based on cost effectiveness methods, and they're used in health technology assessment. And this is kind of like an early stage health technology assessment. It's assessing a technology before there's sufficient data to know the exact care path and to know the exact efficacy. But it's an early shot across the bow of what does this technology do and how can we start to think of its value. You know, because it's early stage and it's kind of a new idea, I look to use existing research to parameterize the model. And so, you know, I look for health system data in whatever jurisdiction we're at, in this case, Alberta, and kind of move out from there to find the best available data to populate the model. And specifically the way I do this, again, not knowing the efficacy yet, is I look for the total headroom for people in this case, in the care continuum, in terms of cost reduced and increased health. And it makes reasonable assumptions about Team CarePal's ability to alleviate them. And I'll just point as well, if anybody wants to interrupt me at any time, please feel free to just turn your mic on and ask me a question. I don't mind being interrupted, and I think that can help with the process. And so just to show the model structure real quickly here, it's a simple looking model. It becomes much more complex in the calculation. And so the left-hand side of this is a basic decision tree, and it's just dividing the population by important characteristics. You know, obviously in health effect, in probability of mortality, in cost of healthcare. You know, the sex and the age are really, really important. You know, women live longer, have a lower health state, and the costs are quite different between males and females based on that. And then, of course, I also make an important differentiation between persons living with dementia and persons not living with dementia. Again, the health states are very, very different for these populations. The costs are very different for these populations, and so it's important to keep that in mind while I'm tracking these people. It is important to point out that this model uses health utility. Specifically, it uses quality adjusted life years. And what that is, it's kind of a measure of your state of health based on, you know, out of 100%, how good is your day to day. So, you know, the average Canadian would be thought to have a health state in the mid 80s, depending on their age. And for my consideration of this model, I did do an adjustment that would be considered an equity adjustment, which is that I considered that persons living with dementia have a health state equal to people who are not PLWDs. You know, it's hard to determine, and it's likely untrue. You know, persons living with dementia do have likely a lowered health state compared to others. But I felt like discounting them compared to other people would be inequitable. And so part of the work I do is to try and account for that and try and adjust for that. And so an interesting thing about this model is that persons living with dementia and others are kind of considered of equivalent worth in terms of health state. Now, here's the model parameters. This is not totally exhaustive, but it's most of the parameters I used in the model. I don't want to go over any individual numbers here or anything. A lot of these values are quite interesting. Some of them could be controversial depending on what type of specialist you are. You know, it's an interesting area. I don't want to go through any of these specifically, but I did want to include these because it's kind of neat. You can look at this page and really get the impression of what data am I using? What are the costs of everything? What are the probabilities of everything happening? You know, everything here would be on a monthly basis. So, other than a cost of hospitalization, which is a one-time event, the other costs are considered monthly for the age and condition that's specified. The probabilities are all monthly. So if you look at, a 65 to 74-year-old who's in this patient group of people in long-term care or near on long-term care, have a 4.2% chance of being hospitalized monthly. And it can be a bit hard to interpret, but looking at these, you can really start to see how much trouble people at or near long-term care are in. To be clear, this patient group is one of the single most expensive patient groups in Canada. They're one of the most at-risk patient groups in Canada. And as you'll see when I go through the model results, this means that there is a lot of room for improvement, but because this particular patient group is so expensive, is in such poor health, is at such high risk of so many bad outcomes, you don't need to do a lot to make it significantly better. And so that's kind of what this model is going to show, is that Team CarePal doesn't have to make a big dent in this problem for it to be extremely cost effective. And so just to go through kind of how this model works, the math is interesting or confusing depending on where you're coming from. But the idea of it I find quite simple, which is something I like about health economics. And so what this model does is, over a 5-year period, month by month, it records all of the costs incurred by a person, and it also records all of the health events for that person, as well as what their considered health utility is. And it accumulates all of these over 5 years and discounts it to the present to show, is this intervention cost effective? Should we do this? And what are the benefits of it if we do? As I mentioned a bit earlier, health utilities are measured in quality adjusted life years, and they're valued at $50,000 per year per quality. And so what this means is, if a person was in perfect health, which, none of us are, but in theory, a person whose health is just perfect and exceptional, adding a year to their life would be $50,000 worth of health in terms of the way Canada views it. Costs and health utilities are discounted at 1.5% annually. This and the 50,000 are CADIS recommendations, and it's kind of just the method that we use in Canada and the UK to evaluate this stuff. And so, the report itself goes through some variances on this. What if we change that value? What if we change some of these, parameters? But generally, this is kind of considered the standard in health economic analysis. And again, the model is parameterized using literature and statistic databases, and it's meant to be updated with results as Team CarePal is used. And so, the obvious question is, since Team CarePal doesn't yet have data on its effectiveness, on how well it's doing for people in care, how do I evaluate its potential? And in this case, I always just look for literature that kind of shows what a potentially reasonable outcome could be for an idea like this. And in this case, I looked at a study of preventative primary care outreach for older adults at risk of functional decline. And so this is essentially, it's a similar patient group to the one that I'm considering, that's either in long-term care already or I keep saying at high risk of long-term care. What I mean by that is, it's people who are very likely to be admitted within 1 year of the date of the start of the model. And so the technical outcome was about, I think, 94% of the people from this group would be in long-term care by the end. And so this study that I looked at, what it found is, in terms of quality adjusted life year improvement, in terms of perceived health utility improvement, it has a relative risk of 1.09. So what that means is that quality of life was improved by essentially 9% by this intervention. And then the next one is a reduction in resource use. So hospitalizations, specifically the cost of just the day-to-day management of these patients in this study. And that one, you can see, is reduced by a bit over 5%. And so, what the model's looking at, to be very kind of simple with it, is that health is improved by 9%, and that resource use, like admission to long-term care, hospitalization, day-to-day cost of caring for one of these people in care, is reduced by a bit over 5%. And so the first thing that you'll notice about these results is that effectiveness is way higher than it needs to be. I just kind of picked that to say, okay, well, what can we expect? And it turns out that an increase in health of 9% and a decrease in resource use of 5% is actually shockingly large. And again, a large part of that relates to how badly off this patient group is and how much room there is for improvement of this particular patient group. So looking at some of the outcomes that my model spit out here, it finds that hospitalizations, and sorry, to go quickly, this is for 1,000 caregivers of people living in LTC over a 5-year period. So it's the caregivers who are using the Team CarePal app in this scenario, but the health outcomes and the cost outcomes I'm talking about are for the people in long-term care who these are caregivers of. And so of those people in long-term care, you can see that again, this is a group that's hospitalized quite a lot. 1,198 hospitalizations over 5 years, only 1,000 caregivers. And this is a group that has quite high mortality and everything like that. So lots of these people are going into hospital every year, or even multiple times a year. And so again, that's part why these numbers are so large, is because it's a group that has a lot to go on. And so, yeah, a reduction in hospitalization of 62 individual hospitalizations, an increase in quality adjusted life years of 58 years. So again, of these 1,000 people, that's not necessarily that an extension in life. For the most part, that's an extension in quality of life. And in fact, I assumed in this one that we would be unable to change the rate of mortality, even though it's very possible for Team CarePal to improve mortality outcomes. I wanted to put that as kind of a conservative assumption that, it's just to see we can still provide value without even doing that. And so, the increase in qualities at that $50,000 rate is about 2.8 million. And so the argument for this part would be you go to a healthcare system and say to them, look, in theory, you're willing to pay this much for health. So the health that we're providing is worth $2.8 million. And so that would be the kind of monetary assessment of the increase in health on that side. On the other side, though, and I think this is the one that's more clear to policymakers, that they kind of hear more loudly, is that this can save quite a lot of money, even for this analysis, which is considering people already in care. It could save $620,000 over this 5-year period in hospitalization for 1,000 patients. It could save $66,000 in ACCS. It can save $45,000 in medications, $80,000 in physicians. And so then we can look at, well, how is the total cost effective? In this scenario, Team CarePal would cost the healthcare system $202,000, which is also, of course, their revenue, which is good. But you can see here that the total cost, even before considering the health gain, like just the pure what are the costs to the healthcare system saved, it saves $610,000 overall. And you can see that most of that savings is due to decreased hospitalizations. And as you'll see, that's a huge value. And the other one, of course, is the cost of long-term care itself. And so I also put in here, this is an interesting discussion that would kind of need its own presentation. But I also think internally of the care homes and their operating costs. There's a big problem in the health system right now that we have to make care more affordable for people. We have to make care better for people. We also need to make care more profitable and more easy for the companies doing it. Like care workers are overworked. They need more downtime. They need less overtime. The companies themselves need better profitability to be able to invest more in their care homes. And so part of the argument that this model makes is that reducing the cost of care per person in care also helps the viability of the care homes themselves, which I think is an often overlooked issue in this kind of complex area. And so you can see in total that I have a net monetary benefit at the bottom. And that's kind of, it's an economic argument, but it's kind of the headline argument of, does this provide value or not? And so as long as the net monetary benefit is positive, in theory, you want to go with it. If the net monetary benefit's negative, you don't. Of course, there's uncertainty around it. So the bigger the value positive, the better. The bigger the value negative, the worse. And in this case, it examines a net monetary benefit of $3.5 million just used for 1,000 caregivers. And so In this argument, that net monetary benefit would be in addition to all costs. Like Team CarePal would take their revenue and the net monetary benefit of 3.5 would exist afterwards. And so this is already clearly cost effective. And when I say that, what I mean is it has a positive net monetary benefit, or in other words, the increase in the health value is greater than the increase in the costs. And in this case, the costs actually decrease. So it's pretty easy to argue that Team CarePal has strong potential to be cost effective here. Now, that analysis was for 1,000.
Is that just Kyle that's frozen?
Except the people that we were considering aren't yet in long-term care, but they're at high risk of admission to long-term care. So these are, I would say, this would be an area of high potential because Team CarePal actually has the ability to delay entry. And in this case, a lot of the stuff would be the same. I'm really assuming that these are similar people who are either in long-term care or out of long-term care, but that their health states are essentially similar. And so in this case, essentially everything else is the same, except for admissions to long-term care are reduced over this 5-year period by 12. And 12, it's interesting, out of 1,000, what that means is some of these people lived through that whole 5-year period and just stayed the whole time out of long-term care. Some of these lack of admissions could be people that, stayed out of long-term care, experienced mortality at home in the 2nd or 3rd year, but never went into long-term care. So it's an overall look at how many of these patients avoided ever being entered into long-term care. And interestingly, 12 seems like maybe a small number until you examine the cost of long-term care. And so this, just for 1,000 people who are at risk of long-term care admission, essentially at the end of the 1st year, the cost of long-term care today, again, for 1,000 people, is thought to be $104 million overall. And that's, that's the total cost. And it kind of makes it even worse because that's the cost both to the healthcare system and to individual patients. I break it down here a little bit that you can see that the health cost is $89,528,000. That includes everything here. But the patient cost of this is $73,926. And what that is the proportion of the long-term care cost that I think is accruing to the individuals. And so it's important to look at this and see that not only is this costing the government a lot of money, this is ruining personal finances as well, even outside of loss of employment or reduction in employment or, extra costs for medications and stuff like this. The cost of long-term care alone can be shattering for individuals. And so the cost savings are significant and they accrue to various actors. And so looking at sort of the total kind of costs, the cost of long-term care can be reduced by $1.8 million over this 5-year period if admission is reduced, as I say, by about 5%. And then the net monetary benefit here is even larger, $4.8 million, or $4.8 million. And then, the total cost savings of $2.4 million. And so, as a result of the extremely high cost of managing these patients, Team CarePal has significant potential to be cost effective and cost saving. The estimate that I used in this report to try and get a handle on, well, how good does Team CarePal need to be, is shockingly high. If Team CarePal could demonstrate that efficacy, it would be amazing. It would be a strict home run for this valuation. And so, this model uses Team CarePal at a cost of $10 per month per user. And so part of what this model is showing is that that's a pretty good deal. The cost of Team CarePal only represents about 25% of the total health cost savings. And that's for the scenario when people are already in long-term care. it represents only 10% when people are at risk of being admitted to long-term care. So that's a pretty good ratio to say that they're only, the way I think about it is, of all the value that Team CarePal is creating in terms of cost savings, they're only trying to capture about 10% of that or 25% of that. And so that's a pretty good deal to the healthcare system that it's kind of being shipped to. So, clearly the most significant cost savings are in reducing hospitalizations and especially reducing admission to long-term care. I really can't stress enough, keeping a person out of long-term care for even a month, even a few months, it can be huge for them at the end of their life because it's freedom for more months. But the cost savings are kind of astonishing, so we really, I think this drives home that we really should be doing everything we can to keep people in the level of care that is appropriate for them and that they prefer, from a humanistic perspective, but very clearly from an economic perspective. And, in my argument throughout of saying, well, Team CarePal really doesn't have to be that effective to be cost effective, this last sentence here is kind of the way, as an economist, that I think about it, which is that, Team CarePal can reduce resource use by 1.4%, and by 6.6% for people who are at risk of long-term care, and it will still be cost effective. And so it only needs to be 1 or 2% effective to really, really be cost effective. And anything above that is producing large amounts of value for the health system. And also I want to point out, Cindy even mentioned that there are quite a few facets of Team CarePal and how it can help for caregivers and people in long-term care. This is only one of 2 models that I've done for Cindy, and the other one focuses on the caregivers themselves and their health effects and their wages and their employment. And it is part of the idea to combine these 2 models and show sort of an overall benefit. But it's also important to note that even with that combined model, even with these 2 models, these are only aspects of the benefit of Team CarePal. Because of course it can be used for other types of caregivers and other types of carees other than those in long-term care. I actually recommended Team CarePal to my mom, who has a friend who's going through end of life care right now and is not in long-term care, is not a senior. But it's just, it's a way to understand and start to argue the potential of Team CarePal and to come up with a quantitative evidence-based kind of argument of why people should adopt it. And I think of it as kind of like a beachhead, is that you get into a location, you show your value, you prove your value, and then you kind of have a home base from which you can work all of your other value arguments, and the idea is, I think you start with some of your best arguments, and I think long-term care is a great argument for Team CarePal, and you kind of build out from there and add things as you go. And as I mentioned, the model's a working representation of Team CarePal's potential, and as Team CarePal gets used more and more, we're definitely going to populate these models with actual effectiveness parameters. And instead of saying, hey, this is what Team CarePal could do, we want to change the conversation to, this is what Team CarePal has done, and this is what it can do if we adopt it even more. And yeah, I don't know if I mentioned yet, I do have a consultancy called HEMA Consulting. That's where I do these economic models from. And, I'm always happy to meet with anybody in the healthcare sector or anything like that, just to get an idea of what you're doing and what future potential we might have.
Perfect. Thank you so much, Kyle. It's always very interesting to see how the brain of an economist works and how you put all those pieces together. It always just is amazing to me. We have a few minutes. Does anyone have any questions for myself or Kyle? Yes, go ahead.
Yeah, hello. Thank you for the presentation. Actually, I have 2 questions. First one is the application which you mentioned for the caregiver in the starting. Like, are we given any sort of training for that to use that specific tool, the
Yeah,
caregiver?
Absolutely. So we'll train if you're wanting a social worker to use it or whoever in your organization, we can onboard them and train them. It's very easy. As far as the application itself, we just had an 80-year-old client use it and go through it, and you'll see that it's blue now. It never used to be blue, and the font is a lot bigger, and so we've made it 80-year-old user friendly. But Team CarePal here is to support as far as customer service and any onboarding, and we can provide documents and training materials as well.
Thank you. And my second question is for Kylie. Like while going through the model, you said that the model records the person's health state outcomes as well. Like, what's the basis for that? Is it based on certain set of questionnaires?
Yeah, ideally, eventually we'll do our own health related quality of life assessment. Like I use, just from the literature, I have a study that shows, the average Canadian, what's their existing health state. And I use that as the basis. And then I discount their health state by other research. So I find, hey, if you have this condition, how much does that depreciate your health state? If you're in long term care, how much does that depreciate your health state? Hospitalization is a big one. And so the original health states I build from the research to kind of make it comparable. Like each health state has to be comparable with itself. But ideally, what we'll do in the future, and Cindy's done a lot of work on this already for this project and others, is we would come up with our own health related quality of life, and we would have people doing that measure for us. And then we would be recording over time, is this value improving based on our expectations? Health related quality of life is kind of difficult to assess. Like this is a big field of health economics that people go out and do these health related quality of life surveys. But they're often not comparable. Like I've seen health related quality of life studies that show no detriment for stage 4 cancer and stuff like this. And so it's not, for me, the monetary values are very, very sharp and very clear. Like this hospitalization really does cost $10,000. This diagnostic really does cost $2,500. Health related quality of life is a bit harder to assess. And so, I do what I can by making it all comparable and kind of being conservative. I assume, if I find a range of outcomes, I kind of assume the lower ones, because I think it's really easy to show, it's $50,000 per quality. It's really easy to show, oh, hey, this improves quality of life. This improves this value so much. But it's not as well assessed as the other elements of it. And so I try and stick with conservative values. But truly what I want to do is have our own health related quality of life survey, because then we can show, look, our person started at a 7. They were really unhappy with the way things were going. We got them up to a 7.6 or a 0.76, despite most people in their situation depreciating over time. So it's a much less solid argument, health related quality of life, but it's so important that it's kind of worth mentioning and worth assessing. And I just try and back it up with stuff like, look, if there are fewer hospitalizations, that patient is definitely doing better, and so it's kind of a combination of showing health related quality of life improving, and then showing other evidence to kind of back that up and support that, to say that our clients say they're feeling better, and hey, they're experiencing fewer falls, they're experiencing fewer hospitalizations, they're costing less in treatment. It's kind of about building that evidentiary basis for me.
Thank you.
And another interesting thing we can point out is if you were looking to, support your employees who may also be caring for a loved one at home while they work for you, we can actually do a customized model for your organization. We just need a few metrics from you guys, depending on like how many employees you have, whether they're male, female, their ages, those types of things. And we can customize a model showcasing, how many hours of productivity we can get back to you guys, possibly how many employees we can retain in a year that would likely leave the workforce due to their caregiving role. So we can definitely set that up for you guys as well.
Yeah, to speak to that, this model focuses on the people in care. The other model I did focuses on the carees or the caregivers themselves. And that is a company using Team CarePal is really good to populate the model. So I'm really pushing that as well, because a company could very much look at, last year, this is how many employees we lost. They might have an idea of how many became caregivers through HR. A lot of people don't necessarily express what they're going through, so we don't always know. But yeah, a company would be a good place to see in 2 or 3 years if Team CarePal has been effective, which I think it will. But the idea is that you would see fewer lost employees, fewer lost hours, which you would be able to measure. And so it is interesting. It's a combination in these models of stuff that's kind of hard to measure, like how are you doing? How is your well-being is a difficult thing to measure. But on the other side of that, losing employment, losing hours at work, hospitalizations, these are all very clear metrics that we can really gauge.
Is there any other questions? We gave a lot for you guys to think about, and so I will gladly record this. I'll upload it and share the recording with you guys, along with maybe the slides and our other health economic model, if you want to take a peek at that one as well. And then I would love to meet with you guys after if you are interested in implementing Team CarePal into your organization, or even just some feedback for us on what your thoughts were on today's meeting would be really incredibly helpful. So I just want to thank you all for joining us, and I hope you have an amazing day. And I look forward to connecting with each one of you over the next week or two. Thank you, Kyle, so much for that presentation. I really appreciate your time.
Yeah, thank you, Cindy, and thank you everybody for joining. I really appreciate your interest in this. It's an important area.
Absolutely. We'll talk to you soon.
Okay, see you soon.